But we neglected that. This is what we're going to leverage on, build it, and then incorporate it into our own programs, and then also our own plans, so that by the time we bring them, those ones are the most vulnerable. You will agree with me, because the people with disability are the most vulnerable, and yet we don't bring them in. So, and those in the communities, do we build their resilience? We need to build their resilience. Let them know, and then let them know what to do in case there is anything. So we don't do that. And by way of communicating to them, we have to have a very strategic communication system that will tell them what we want, not the way we read in the books. We have to come to their level and then communicate with them. If it is possible, we can bring some of their communities, those who are enlightened, train them, and then use their dialect, use their own language, and communicate with them, so that there will be efficient, and then that will reduce the vulnerability, as well as, if there is anything, the rate of casualties. So, some potential strategies to achieve those things is establishing a unified coordination mechanism. Do we have that? We have, Professor Dutia used to ask where are those things, since we have them in place. Yes, we have them, but in most cases they are outdated, but we don't sit down to update them. And then also developing standardized communication protocols. Do we have? Is there any agency that have a standardized communication protocols? This is a very vital, very important aspect in disaster management. If we don't have communication protocols, then we have a long way to go. We need to have such. The only thing we do now, we wait for somebody to report an incident, either through 112 or call person directly, and then you start activating people individually. And some people, when you call them, you don't get them. So if we have a protocol, established protocol, standardized, then we don't have to have any problem. And that will help us. And the communication protocol does not start and end with the responders. You have to also involve the communities to know. Conducting joint training exercises and simulations. I'm very much sure here, when last did responders in our